It took no time at all for Governor Michelle Lujan Grisham's latest public health order to come under legal challenge. Two women have filed a lawsuit in U.S. District Court challenging the constitutionality of Governor Lujan Grisham's vaccine mandate for certain workers. We'll get into that in a second. In light of the recent surge of COVID-19 cases tied to the Delta variant, here to discuss the pandemic pushback are this week's Line panelists, starting with Line regular and former state senator Dee Dee Feldman's with us. We also welcome back to our virtual roundtable Dan Boyd, Capitol Bureau Chief at the Albuquerque Journal. And we're super thrilled to welcome back Michael Bird, fresh off a short relocation stint on the West Coast. He's also a public health consultant, so glad to have you back, Michael, honestly. Now, Dan, let me start with you. The lawsuit hinges in part on the fact that the plaintiffs say the vaccine has now been fully approved by the FDA, but just this week, the FDA has done just that with the Pfizer vaccine, as we all know. What impact does that decision have on this litigation?
Yeah, I think that's yet to be seen. I would certainly think that would undercut one of their main claims that this is an experimental vaccine. The lawsuit didn't come as a big surprise to me. I mean, we've seen that in other states, kind of similar lawsuits. One of the plaintiffs in the New Mexico case is a healthcare worker in Albuquerque, and that was one of the occupations kind of targeted by this vaccine mandate. And the other one was a mother of children who are participating in the state fair. The governor also said that attending the state fair, you'll have to show a proof of vaccination with a few allowable exemptions. We'll see how this all plays out kind of in the courts. And certainly as well, I think to see in the healthcare industry what kind of impact it has as far as folks either getting vaccinated and complying, or maybe some of them, losing their jobs or leaving their jobs over it.
Michael, Dan mentioned one of the plaintiffs is a registered nurse, Jennifer Blackford. She's a Bernalillo County resident. She works as a nurse at Press here in Albuquerque. We know that New Mexico is already facing a shortage of healthcare professionals before fighting COVID for a year and a half took a big toll. Here's the question. Does the governor run the risk of launching a wave of mass resignations with this vaccine mandate for healthcare workers? Or in your experience as a healthcare person yourself, that's not possible. People are not just going to walk away en masse from these kind of jobs. Which is it in your view?
Well, first of all, I think anybody who's working in the healthcare field, and as you referenced, Gene, I did work in the Santa Fe Indian Hospital on the floor with many nurses in the past, and have found them, physicians and the whole healthcare team are really critical. But I have to say that I have a lot of respect for nurses, both in the hospital and public health nurses as well. And it just seems to me that there's a real contradiction. If we are there to promote the health and meet the needs of patients, then we really have a duty and an obligation, both personally and professionally, to do everything we can to ensure those patients' safety. And so I really have an issue with someone taking that position who considers themselves to be a healthcare provider, be it a nurse or anyone else. I think that if you're in healthcare, you're there to meet the needs of the patients in the community, and first and foremost to protect them. And if you're not willing to do that, then I think you may be in the wrong profession. I'm sorry to say.
Let me follow up with this. David Scrace, who's the interim health secretary here for New Mexico, he says that 90% of nurses, hospital nurses, are vaccinated already. The Nurses Association doesn't have a problem with this. Can these last 10% folks get squeezed enough to just kind of get there? Is it a small enough group in your view?
Well, I having been out of New Mexico for a bit now, it's hard for me really to respond to that. I think, though, here's my own personal thought. My own personal thought is that there are lessons, again, to be learned from other communities, and the Native community has the highest COVID rate. Highest vaccination rate of any community of color of any population in the state, according to the CDC in a report last week. So it just seems to me that there are communities that recognize that, yes, the rights of individuals are important, but the collective good, the tribal good, the larger community, we really have an obligation. And maybe it's because of the history of Native people in this country and all the diseases that they've been subject to, which came from Europe. And so they recognize in a very different way, in a collective way, that you have to respond immediately. And the tribal leadership has provided great leadership in terms of taking public health practices, adopting them, and implementing within their own communities. I think there's some lessons to be learned, and I think some people really need to have some honest conversations with themselves about who do they serve? Are you serving yourself? Are you serving your family? Are you serving your community? And I think that's a question that many people need to begin to ask themselves.
Senator, the other plaintiff in the lawsuit is upset that the new vaccine mandate for entry to the state fair. She's a county extension agent and a mom of 2 girls with animals, entered into competition at the state fair. The governor has made a point, of trying to lead by example with vaccine mandates, but was this a step too far given the last minute notice on this?
Well, Gene, I think that really the state fair is one of the few super spreader events that the state government has control of. It doesn't have control of the balloon fiesta. It doesn't have control of Indian Market. And so this was, in my view, not a step too far. And I think that, they ought to make some accommodations, make some of those livestock events outdoors. But in general, it's not a step too far to ask adults and teenagers to be vaccinated. There are some young children for whom the vaccination is not possible.
Right.
And I assume that they will probably be accommodated, but I don't know.
Senator, I hear your point loud and clear here, but I think it's a timing issue as well. There's a lot of folks I've talked to from that part of the state that feel like the governor did this on purpose, like this is some kind of payback to not give enough run-up time here to get these kids vaccinated. Is that a step too far, feeling that way?
Yes, I think that is a step too far. I think that that's a step too far in terms of believing that the governor is a tyrant and is doing things arbitrarily.
But could the timing have been better?
Yes, the timing could have been better, but the virus requires instantaneous decisions because it's changing and mutating on a daily and weekly basis. So you have to respond. I mean, I think if you have the interests of the entire population at heart, you do have to respond and make some of these controversial decisions. But I think the reaction of some of the anti-vaxxers has gone too far itself. Blair Dunn, who is the lawyer for these folks, has compared Michelle Lujan Grisham to a tyrant who is putting people in concentration camps, tantamount to Japanese internment. I think that's insulting.
It is insulting.
I think that's really insulting to Japanese people and to others who have taken the vaccination in good faith.
I appreciate you getting that last bit in there. It is insulting. There's no other way to say that. Dan, interestingly, let me go to something else. The legal challenges to the governor's authority regarding public health orders has been upheld time and time again in state court, as you and others at your paper have reported, and in federal court, even as the Supreme Court has refused to hear suits against the vaccine requirement for students in Indiana. Why would this be any different this time? Another court challenge?
I think likelihood. I mean, you never want to wager on the court system, but I think I would think there's a good chance that the governor's authority here is upheld. Other governors have also issued kind of these targeted vaccine mandates, especially now with Presbyterian and other private employers also adopting their own vaccine policies. I mean, it seems pretty well established. I'm no lawyer, but that that private employers can set these policies for their employees. It's a little different when it's the state doing that. And I do think there's been a lot of discussion. I think I can say that there wasn't even total agreement within the governor's office and the governor's cabinet on some of these decisions. I mean, these are hard decisions. There's either way, I think there's going to be pros and cons and pushback, no matter what you do.
Hey, Michael, in the past week, we've seen protests across the state against masks and vaccine mandates. And quite noisily, some local church leaders pretty vocal in their intentions to not enforce mask mandates during weekly service. Does the governor have any real power or sway in terms of the mask enforcement at this point? Is it going to take more monetary fines maybe to make her point? Or what can she do about people who are willing to have folks gather and just not do what she wants them to do?
Yeah, well, I think that, you know, that what I have to reflect on is my old catechism
Sure.
class, and I was probably a dropout if anything else. But but one thing I do recall and do remember was, "Am I not my brother's keeper?"
Mm-hmm.
And I know for myself, and I don't speak for anyone but myself, I know for myself I have a duty and an obligation to protect everyone. Those who are close to me and who I love and are dear, as well as anyone else who could suffer death or long-term consequences because of COVID. And so I just, it's really hard for me to understand how churches could take a position, some churches, because it's not all,
Right.
but some churches would take this position that it somehow is an imposition upon them. I think that there needs to be a real conversation in those churches and across churches, I think, about what do we value. There's a lot of conversation about valuing human life. There's a lot of conversation about when does life begin and when does it end. Well, we also need to have a conversation about the sacredness of life and protecting all life. And that would be my response.
Good points there. That's all the time we have this week for that discussion. Still to come. This week on The Line, New Mexico opens its arms to Afghan refugees.